Hi all, I am Dr. Aparna. Today I am discussing about balloon sinuplasty. Balloon sinuplasty is a technique used to treat chronic rhinosinusitis. Sinuses are air-filled cavities in our head. So there are almost 40 sinuses or 40 air-filled cavities in our head. So these are like rooms in our head. So this should be completely air-filled. There should not be any water, there should not be any pus or infection, anything should not be there. So whenever we inhale the oxygen, the air will through the nose, that will go to the sinuses, it will circulate in the sinuses, ventilate the sinuses, and then it will go to the lungs. So if any water or pus, anything is there, the ventilation will not be good. So the ventilation will be affected. So all these sinuses has a door, like rooms, that is called ostia, that is opening into the nose. So when a patient is getting an allergy or a patient is having an infection, the doors are getting very tightly closed. So what happens, whatever there inside the water, pus, that will start accumulating inside because it cannot come out through the nose. So in that case, when it is for a long time, it is called chronic rhinosinusitis. For this kind of patient, our aim is to open the door, open the ostias and clean the sinuses. If we are not cleaning, what happens? If we are not cleaning the sinuses, after few months, few years later, the pus will be increasing in amount. It will start accumulating inside, and the most important thing is the sinuses are located very close to the eye and brain. So this infection from the sinus will spread to the eye and brain, which are very dangerous conditions. So we have to open the sinus. We have to open all the doors, all the ostias, and take out the pus to clean the sinuses. That is our aim. So there are so many methods to clean the sinuses. There are many surgeries like functional endoscopic sinus surgery, and there are instruments like debrider, everything is there. But still, some sinuses are very deeply located or very difficult to open with this instrument. So in that case, the balloon sinuplasty plays an important role. So balloon sinuplasty is a small instrument, like a pen-like instrument, which is attached with a small balloon kind of thing with that. So what we will do, we will put inside the instrument, like we will be doing under endoscopic vision. So through the nose there will not be any cut, there will not be any bleeding, no outside scar, nothing. With the endoscope we will put the small instrument inside and we will inflate the balloon. So the sinuses, which are very tightly closed, when we put inside the balloon, it will inflate. With the balloon, the sinus ostias also get opened up. So we can clean all the pus infection from the sinuses. Why we are talking about balloon sinuplasty, and this is like an advanced technique. These techniques are not available in all hospitals or all areas. So we have to promote this kind of thing because there are so many advantages for the balloon sinuplasty. For example, less bleeding, less trauma to the nose, and main important thing, our nose should be very much functional after the surgery. The functional mucosa will not be affected after the balloon sinuplasty. So patient will not be having much pain, much trouble, nothing. So that is why we are talking about balloon sinuplasty, and if you want to know more about this, do visit our MAA ENT hospital and we will there to help.